obesity is certainly a medical problem, and can lead to heart attacks and all kinds of health problems. It is not a moral deficit. It is not a willpower problem. Basically, what's happened here is we are sabotaged by our biology. God made us, evolution made us, we're made in such a way that our biology is preparing us for the next famine, the next disease where something's going to happen, so we have to store up food. All those forces that are trying to balance between getting enough calories, energy in, and storing up for the famine versus the energy we need to live, they're in a teeter-totter relationship with one another, and our biology is telling us to get bigger. And yes, choices matter. Yes, no matter what you do, lose weight, you've got to work with the program. That surgery, you can't sabotage the surgery. You've got to work with a tool, an excellent tool to help you lose weight. But it's really not. It's not your fault. And the science backs that up. Anyway, we'll go through some steps and talk some more. Sorry that my slide clicker doesn't work. So my other trusted, we've got all kinds of audio. Why weight? A lot of people have been struggling with the weight for a long time. They've tried all kinds of things, all sorts of diets, exercise, acupuncture, hypnosis, you name it, all kinds of things. And of course, the phrase fat and happy is not necessarily, being obese is not necessarily equated with happy. You make fun of it, be nice to fat people. One day save their life. This guy, all he has to do is outrun this guy, not the bear. I'm fat, I'm happy, got a problem with that. I mean, we kind of make light of a problem that is really a serious problem. What is obesity? Why does it matter? Obesity, disease in which fat is accumulated to the extent that health is impaired. A lot of factors that get into it. It's lifelong, it's progressive. It just keeps going and going. It's definitely life-threatening to the cost. The factors that lead to it are, there really are a lot of factors. These are genes. We know that there are people who seem to eat anything they want, and they don't get that. It's environment, it's social, it is to some extent, voice, it's psychological, and metabolism. The big thing here is the metabolism, hormones, chemistry, and hormones, and everything already in the body. Difficult in this day and age. We're not in a famine. It's real easy to go to fast food. I'm probably going to choose that over that for obvious reasons. I think most people would. But the take-home point on this is that there's a metabolic set point. The body and its hormones and all these neurohumoral factors, and it's really complex. We won't get into that much at all. But your body is trying to maintain a set point, which it thinks of as normal, and it keeps setting that point higher and higher. There are a whole bunch of hormones, two of them that we know a little bit more about. Leptin, skin hormone, ghrelin, fat hormone. They're talking to your brain about, okay, I've had enough to eat, or I haven't had enough to eat, and they're trying to balance this out and make it that way. And in theory, they ought to balance it out so that you stay at a good weight. But what happens is when you lose weight, the hormone that's trying to tell your brain to eat more wins out, and you end up lose weight, gain it back, lose weight, gain it back. Usually with a little bit more. I'm sure that you can all tell me all about it. Really complex slide, and we'll get into it. We're going to think it's fast. Show these to doctors, and it makes their heads spin too. We don't know everything about it. But it's complex, it's hormonal, it's in your biology, it's not your fault. How do we measure obesity? Okay, there's a thing called body mass index, which is basically your weight in kilograms divided by your height in meters squared. There are all kinds of calculators. You don't have to worry about doing this. But if your body mass is over 40, that's morbid obesity. Pretty much all the studies and all the science and all the insurance companies consider body mass over 40 is morbid obesity, and that's pretty much an automatic. You would qualify. In theory, you'd qualify to have surgery. 30 times these other weights, normal 18 to 25, you're overweight if it's 25 to 30. There's some in-between obesity classes, 30, 20, 30, and 40. Don't worry about that for right now, but those are important too. And a lot of patients have BMI between 35 and 40, and if they've got comorbidities, they probably should have surgery. It's an epidemic. You're not alone. It's estimated data that's kind of going out of date. It's probably worse than this now, but approximately 70% of adults are either overweight or obese. A lot of children, 17%. 6% of adults are extremely obese, BMI over 40. That is a 400% increase since 1986. These maps are a little bit old and out of date, but you get the gist of it. You go from light blue through yellow and up to orange and red. The obesity prevalence is worse. In 1990, it wasn't so bad. In 2000, it's starting to get worrisome. 2010, it's gone crazy. And breaking it down by states. Mississippi is ahead of us. Another slide that shows West Virginia. Well, yeah, West Virginia, we're right up there. We're winning the Alabama. We want to be number one. Alabama, Auburn. We're real close to being number one in the East. Trend lines are all going up. Children and adolescents. Trends in men and women, adults, they're all going up. This line looks flat, but it's really worrisome because this is the extreme obesity lines, and they're just trending up and up, and they're starting to turn and getting more sharply elevating as time goes on. Costs. Again, apologize for the whole day, but it is more than this now. The total amount of medical costs for obesity, 2008, 11 years ago, thought to be $147 billion. Obese folks spend 42% more on direct healthcare costs compared to healthy folks. There's absenteeism. This is the social cost of work-related costs, estimated at $73 billion for sickness associated with obesity, having people be out of work and absentee. This is a take home. This each BMI point over normal thought to cost $200 per year per employee. So 20 times 200 per year per employee if BMI is 40, it's got to be almost 20. Next. Medical visits and costs go up as the BMI goes up. Whenever you are, the more the costs and more the medical visits. What's the cost in terms of deaths? You hear about the opioid crisis. It's for real. More people die every year from the opioid crisis than died in all of the Vietnam War. Well, it's like 50-something thousand. Okay, there's 300,000 obesity-related deaths every year. It's 6 times worse than the opioid crisis. Right? Second leading cause of preventable deaths in the U.S. because of all kinds of things. Of course, heart attacks. There's a number of cancers, and there's a lot of other diseases and problems that are obesity related. And it is measured in just life expectancy. The higher your BMI, the knows for sure, but we all know people who are big and lived into their 80s and 90s, but just on statistics wise. And what we're trying to do with the metabolic surgery is win back those potential years of life lost, get you down to a normal or more normal weight so that you can win back those years. And all the studies that go back years. First gastric bypass was done in the late 1960s. It wasn't laparoscopic. We didn't start doing those until here around 2001. In the late 1990s, a lot of laparoscopic surgery came in. And then metabolic or weight loss surgery kind of took off. And health conditions related to obesity, lung problems, psychological problems, depression, stroke, acid reflux, all the metabolic syndromes that go to damage to the heart, diabetes, high cholesterol and lipids, high blood pressure, pancreatitis, a whole bunch of cancers are more prevalent if you're obese or morbidly obese, much more so than if you're normal weight. Blood clots, problems with gynecologic abnormalities, gallbladder disease, fatty liver disease, and cirrhosis. This goes on and on. Physical and psychological obstacles. This kind of gets this where you fit into society. And I would propose to you that there's a whole lot more discrimination against obesity than overweight. So the world is not made for people who are morbidly obese and their biology is sabotaging them. There's a lot of things that are tried for weight loss, all the things you see on TV, different diets, behavioral things. I'm just going to sum it up and tell you all of those things, diet and exercise, nutritional systems, clubs, breeders, anonymous, all kinds of things, they can work, but their success rate long term is definitely less than 5%. Really look at the statistics honestly long term. Definitely less than 5%. In a lot of cases, it's less than 1 or 2%. Now, surgery, and we've got some of these listed up here. Surgery's not perfect either. It's not 100%. It's not 90%. The success rate with surgeries that we commonly do are about 70%. 70. And we wish it was 95%. Working to try to get it there, but we're about 70% successful. That's not perfect, but it's way better than 2% or 5%. What are the surgical options? There's some stuff that's in here. I think because we all love before and afters, and a lot of famous people who've had wonderful success because of bariatric or metabolic weight loss surgery. Kind of changing the name. It's not so much weight loss surgery or bariatric surgery. It goes back to 1978. But the idea of metabolic surgery, this surgery is changing your essential metabolism. Easy proof or illustration of that is that a patient with diabetes who's had the surgery and find that they need a whole lot less insulin, or maybe come off of their diabetes pills like within a day or two after surgery, before they've lost any weight, because things change metabolically, hormones. The changes are huge and they're not totally understood. They're really fantastic. About 80%, for example, about 80% of diabetics who are on diet pills will end up being off of their diabetes. And the insulin users, well, maybe they won't come off of it, they'll use a lot less insulin. And patients who are taking 200 and 300 units of insulin a day will down to 30 or 40. On that note, the American Diabetes Association, don't look at this too closely, it's too complex a slide, but